Okay, good afternoon. Assalamu alaikum, everybody. Welcome to today's webinar. I'm very excited for all of you to join us today, and very excited to bring to you part 3 of this webinar series. We've had part 1 and part 2, and we've received very good feedback, and we've also benefited from your participation in the webinar. So we look forward to your participation today. So today, as I mentioned, this is part 3 of this 5-part webinar series. And today we're focusing on evidence-based interdisciplinary care in the management of ASD, Autism Spectrum Disorder. So as I mentioned, this is part 3 of a 5-part series that we're bringing to you on a weekly basis on a Wednesday afternoon from 12 until 1 p.m. So next week, again, we'll be joining you. Next week, we're focusing on creating a multidisciplinary system of care. So before we start today's webinar, I just want to give a big thank you to our experts who are joining us today. So our experts are joining us from the Child Development Center, and shortly my colleague, Dr. Shahad, who will be moderating today's webinar, will be introducing you to today's speakers. Before we start as well, I'd like to just inform you that the presenting authors and the Scientific Planning Committee have no relationships and no conflict of interest to disclose. The learning objectives of today's webinar will be discussing evidence-based therapies and services provided to children with autism, and describing the roles of other healthcare providers in providing care for children with autism. To claim your CPD points, you'll need to complete the CPD evaluation survey. So what I'll be doing after today's webinar, I'll take the attendance report and I'll be emailing you the survey. So please complete the survey. It will close after 60 minutes. So today it will close at 1 p.m. So please complete the survey. Sorry, it will close at 2 p.m. So please complete the survey before 2 p.m. and we will be sending your attendance to DHP. Please, I would like you to just reserve the chat for asking questions and making comments relevant to the learning content today. So please avoid writing good afternoon or putting your credentials in the chat. Just reserve the chat for relevant questions to the speakers. Then we'll be able to get through as many of the questions as we can today. So without further ado, I'd like to introduce Dr. Shahad Al-Amin, who will be moderating today's discussions and putting your questions to today's experts. Thank you very much.
Thank you so much, Dr. Zakaria, for this introduction. As you mentioned, this session is one of the long-awaited sessions, and it makes sense because today, as always, is your chance. Ask away, ask questions, discuss challenges, discuss practical strategies. Today, it's all about evidence-based care provided to children with autism. We're also grateful to be joined today by such a diverse set of speakers from the CDC. Child Development Center for Special Needs is a private provider of multidisciplinary therapy services for children with autism in Doha. The team from the Child Development Center for Special Needs includes behavior analysts, a speech therapist, feeding therapist, and an occupational therapist, all of whom specialize in the provision of quality multidisciplinary evidence-based intervention for children with autism. Please welcome to the virtual stage Ms. Camila Janik, Mrs. Alexandra Wood, Mr. Antonio Rena Hidalgo, Ms. Anila Mittal, and Ms. Sumaya Ravendranath. Ms. Camila and your team, the stage is yours.
Thank you, Dr. Shahad. Good afternoon, everyone. My name is Camila, and I'm the director of the Child Development Center. We are very grateful and privileged to be providing this section of this wonderful CPD in collaboration with Qatar University. And as Dr. Shaht mentioned, we are looking at evidence-based therapies for children with autism today. So we will start with applied behavior analysis. And we have 2 of our experts in the field of ABA therapy, Mr. Antonio, who's a board-certified behavior analyst, and Ms. Alexandra, who's a doctoral level ABA clinician. And they will introduce us to ABA. So let me start with just a little disclaimer, and let's start with ABA.
Okay, thank you so much. So let me start with explaining a little bit about interdisciplinary care. So what is interdisciplinary care and why this is important? So most of the times there's a need for a group of professionals from different disciplines to be able to meet all the complex needs of our clients. We here at TDC, applied behavior analysts, speech and occupational therapy clinicians, we work very closely together to develop individualized education plans in our early intervention program to target different goals that aim to improve the lives and the general development of our children. And why is this interdisciplinary teamwork becoming more and more necessary? So just to mention a couple of facts, there is for sure an increasing complexity of skills and knowledge required to provide comprehensive care to clients. And this increasing complexity comes together with an increasing specialization within health professions, meaning that it will not be possible to meet all the needs of our patients from only one approach or discipline. So now my colleague Alexandra will start explaining more in detail about applied behavior analysis.
Good afternoon, everyone. So applied behavior analysis is a science that aims to improve socially significant behaviors in children with autism, and we do it by using experimentation to find out the variables that are responsible for that improvement in behavior. And ABA is recognized in many fields such as education, psychology, behavioral medicine, and others. And it's, of course, an evidence-based practice, and it is recognized by many international organizations such as CDC or American Pediatric Association as a gold standard treatment for children with autism. And this is what we are practicing here locally at Child Development Center. And very interesting fact is that, as you can see here in this figure to the right, the number of certified behavior analysts increased from 2016, where we only had 3, and now we have 10, which is a very good and positive trend that we are observing. And we are hoping that we will see higher numbers in the future, and because that ensures the highest level of care provided to our clients. Thank you very much.
Good afternoon, everyone. My name is Anila Mittal, and I'm a speech-language pathologist. I've been working in the pediatric population for almost 20 years, and I'm here today to discuss the role of speech therapy in the management of care for children with autism, as well as dive into some evidence-based therapies that we have. This is session 3, so as we all know, autism is a neurological condition characterized by delayed language skills, poorly developed social skills, and repetitive restrictive behaviors. Now, 2 out of those 3 domains, language skills and social skills, are areas of domains where speech therapists focus on. Now, specifically for children with autism, the typical foci or the typical areas that we focus on are language, cognitive linguistic skills, as well as social pragmatic skills. We also focus on speech sound production, which is very important But typically for kids, we're talking about, if you look at the first 10, attention skills, play skills, motivation to communicate, receptive language, expressive language, conversational skills, and descriptive language. And if we want to look at the last 2 points, communication aids and devices, we're going to look at this for children who maybe are not ready to speak yet, who don't have the words, and who are nonverbal at the moment. So these are anything from sign language, iPad, any device that might help these children, get the words out. Feeding disorders is another aspect of speech therapy. There are some speech therapists, including myself, who are trained to help children manage food and improve their feeding skills. So now when we look at therapies available for children with autism, there are so many, and there are so many evidence-based therapies. There's a long list of evidence-based therapies which all therapists who work with children with autism apply. ABA, which Dr. Wood and Mr. Antonio have talked about, the prompt hierarchy, imitation and modeling, social stories, which is basically taking social scenarios and applying visuals to help the child really understand how to manage themselves in a social situation. Visual supports, as I spoke about earlier, AAC, augmentative and alternative communication, as well as PECS.
Good afternoon, everyone. I am Soumya. I'm an occupational therapist and also SI trained therapist. So what is occupational therapy? Occupational therapy is a branch of healthcare that helps promote independence for all individuals. It also helps improving participation in occupation. So what is occupation? Occupation can be different for different people depending upon gender, age group. For a child, it is majorly play. Role of OT in a multidisciplinary team. What are the different intervention strategies that we use in individuals with ASD? The first and most important one is the frame of reference. Now, what is a frame of reference? A frame of reference is a guide that we use, in which we use theories as a guide to see and put it in practical application. And theory forms the basis for the evaluation, assessment, and then apply it into practice. The major frames of references are developmental frame of reference, cognitive behavioral frame of reference, sensory integration frame of reference. We also use activity analysis. Now, let's take writing. Writing is a small activity, but it has multiple components to it. So as an occupational therapist, I will divide the writing into multiple subtasks and see what are the areas of concerns so that I can plan my treatment goals accordingly and cater to specific areas of concerns that the child has with respect to writing. Moving on to sensory integration therapy, it forms the basis of most treatment strategies in individuals with ASD in an OT setting. What is sensory integration? It is a 3-step process, to put it in brief. The first is processing, the second is integration, and the third is organization. Now let's take a small example. All of you all are listening to me talk. That is processing. The second step is you all are trying to understand what I'm talking and make sense of it. That is integration. And the third step is organization and giving me a desired output, hopefully by nodding yes to what I'm saying. And that is an adaptive response, what I'm looking at when I treat a child with ASD. That adaptive response is key to my treatment setting. And during the session, that's the main thing that I'll look for. Thank you so much, and we are open for questions.
Thank you all. So we will now stop sharing the screen and take questions.
Many thanks, Ms. Camila, and everyone on the team for this insightful and very informative presentation. We have so many questions, even questions from past sessions that are related to this very intriguing topic. Perhaps we can start from one of today's questions. You've mentioned about sensory integration. So does this help with sensory overload? And in general, what are the approaches of reducing symptoms in relation to sensory overload?
So sensory overload is something when an autistic individual feels when there are multiple inputs coming to them and they are unable to channelize or organize those inputs and give an adaptive response to you. And that's when it's discomforting, or we see behaviors like flapping or jumping. Those are calming behaviors for kids, and they do it to regulate themselves and to act better in a given environment or situation. So in a OT setup, when we apply sensory integration into our treatment strategy, we first analyze what concerns that individual has. So the sensory integration has three base concepts or three base areas where we cater to most importantly. The three inputs that we look into is vestibular. Vestibular is anything related to movement. Second is proprioception. Proprioception is something related to our own body posture or understanding the pressure of what our body is doing and how we are doing a certain action. The third one is tactile or touch. So a lot of kids you might know will not like to touch certain textures or eat certain textures or avoid certain textures, or might also be seeking a few textures. So these form the basis of our, sensory integration triad, and we plan our treatment based on this. There is a lot more like, smell, auditory, visual, and gustatory, and all of that. So there is a sensory assessment that we do, which is called a sensory profile for a caregiver. It depends upon the age group of the child, how we provide the sensory profile to the caregiver. There is a toddler's profile for 3 to 5. There is an adolescent profile from 11 to 16. So there are various profiles, and the question varies according to the child group of the age of the child.
Thank you so much for this comprehensive answer. Perhaps can you discuss any approaches that you can tell the parents to use at home to help with sensory overload?
It depends. It's very subjective and it will depend from child to child. So, a sensory overload. So, for example, if the child is too avoiding towards light or excessive sound, so of course, if the child goes to a mall or if the child goes to a crowded place, it's going to be very difficult for that child to, process all the information and be, calm and quiet, because it's already too distressing for the child. So a few strategies that I can advise in general or suggest in general is like noise cancelling headphones are one good strategy if you know your child is going to be overwhelmed with the sounds around you. Another one is if you know that your child does not like crowded spaces, try and take something comforting along with you that the child can hold on to, so that it's something that the child uses to soothe themselves, so that the crowd is not too bothersome for the child. Also, you can so if a child is tactile seeking, give bear hugs, hold the child tight close to your body, and count to 5 and then release slowly. So these are some strategies that might help when the child is in sensory overload.
Thank you so much. I think what you just said, it speaks to the importance of collaboration, not only within the healthcare team, but also with the parents, because there are things that they can also do at home to help reduce the symptoms. Perhaps we can go to our next question. Do you have any knowledge of any emergent therapies that you believe have potential in addressing core ASD symptoms or enhancing the quality of life of individuals with ASD and their families in general?
So yes, there are some emerging therapies that are kind of being researched now and are on the forefront. They haven't yet been established as evidence-based, but music therapy is one which is on everybody's radar today. You know, there are a lot of children who benefit from this. This has not yet been established as evidence-based, but it is something that even anecdotally, I have seen, you know, many children really benefit from that. Within speech therapy, there are a few emergent therapies such as prompt. So prompt therapy is something that many clinicians use to help shape speech for children who are having difficulty getting those words out clearly.
That's really interesting. Thank you so much. Our next question is one that we kept hearing a lot during all sessions. It's really in relation to food and diet. What is your opinion on food exclusion diets? What's your experience with it? Does it work? Does it help? If so, how much should the child go on, like for how long should they go on diet?
So I love this question because I have a lot of parents who ask me about restrictive diets, gluten-free, dairy-free. You know, they obviously want to optimize the diet of their child. Now, today, the short answer is no. There is no research that supports restrictive diets in improving behaviors or symptoms of autism. Now, as a feeding therapist, when I see children who are coming, you know, already they have a very restrictive diet, you know, it's kind of a two-pronged answer. One, I love to encourage parents to get further testing. There are centers here in Qatar who do allergy panels and food sensitivity tests. This might be why the child is avoiding some foods. If a child has a sensitivity to gluten, and every time this child is eating a bowl of pasta or some crackers or anything, bread, they have a bellyache and they can't express it. So that's something we're going to want to address, but with the appropriate medical supervision and guidance. So the same thing goes for, so when I said a two-pronged approach, these are children who have very restricted diets. Many of these children have very restricted diets. So we don't want to willy-nilly further restrict them when they already are only eating, you know, maybe a handful of things and they're not getting that diverse, you know, nutrition profile. So, you know, the short answer is no, there is no, you know, data that supports that restricting a diet will, you know, render any positive changes for a child with autism. However, I personally believe, you know, as a feeding therapist, it is very important for parents to, you know, look into this and to understand why the child might be, you know, restricting their foods.
That's actually a really important point that you mentioned here, and it's something that we heard across the different sessions. Even an example with the session about co-occurring conditions, the fact that a child or an individual, they have autism, sometimes if they have other symptoms that are even unrelated to autism, this can just, you know, be anchored to autism, and then people would miss the other factors or the other conditions that the individual can have. Thank you so much for answering this question. We have an go ahead, Doctor.
Yeah, just to follow up that question, because I had, like you said, there has been a lot of inquiries about diet. So just to follow up that question, would you be able to comment as well on maybe the role of food additives and also about the pregnant mother diet, pregnant mother's diet as well?
I'm so sorry. Do you mind repeating?
Yeah, would you be able to comment on maybe the role of food additives, and also if there is implications on regarding the mother's diet? So when a mother's pregnant, is there any sort of implications from that side as well?
So the second question, currently there is no research or evidence that, dictates the quality of the mother's diet and the likelihood of the child having autism. With regards to food additives, it's the same. It's similar across the board. There is no real research now that supports, whether additives in foods will exacerbate autism. However, like all individuals, these additives, whatever we're learning about the effects, will have similar effects for children on the spectrum as well as for children on, not in the typical developing population.
Thank you.
Thank you so much. One other quote unquote intervention that we keep getting a lot of questions about is physical activity at home. What's your opinion on this? Are there any approaches to physical activity that can actually help with ASD symptoms?
So physical activity can help depending upon what the child seeks out. So for example, a child who spins around in the house or keeps twirling around, walks on toes, physical activity, but with some amount of pressure. Running might not help that child, but putting the hands on the wall and pushing the wall 10 times might help the child calm down a little bit more and focus bit better than what he was doing 10 minutes ago. That's because in this strategy, we are using the proprioception as our baseline. And what we are trying to do is we are trying to provide proprioception and alert the child's brain to focus more and not seek out movement. There can be a combination of proprioception along with vestibular. So when I put a child on the swing, I will ask the child to push the swing and get the movement. So what I'm trying to do here is I'm asking the child to put pressure on the swing and get the desired movement. So I'm actively getting the child's attention and the child is actively participating with me. So I have some interaction going on. So physical activity can be helpful, but it depends on the context. When you talk about what the parents can do at home, I would suggest activities that involve some amount of pressure. So any animal walk. So walk like a bear, stomp like an elephant, or hop like a bunny. These activities will help the child, um, calm down and focus more and regulate themselves to a certain extent.
Thank you so much. I think a common theme of a lot of the interventions we talk about right now at home is that it's not that there aren't stuff to do at home, but it's what the parents should do. And it's really important for them to basically talk with their healthcare providers and work together to make sure that they have the best plan for their children.
Right.
Perhaps I can segue from this question to another question we got in our chat. What is the role of physiotherapy in the care of ASD? And can you perhaps elaborate on the difference between physiotherapy and occupational therapy?
Yes, so a physical therapist or a physiotherapist will cater to all physical needs of individuals. So, for example, if I have a child with ASD and that child has concerns with tone, imbalance, or any difficulties or any muscle related issue, a physiotherapy session or a physiotherapist will cater to those needs. An occupational therapist, on the other hand, will look at it in a more holistic way, and I will focus on how that child or how that individual can function to their optimal level in their daily life setting. So my goals will start from how the child is able to brush, or whether the child is able to sleep with a blanket on, or whether the child is able to put the socks on without having an issue, or is the child able to tie a lace, or is the child able to take the school bag on, and so on and so forth. So occupational therapy is a lot more holistic when it comes to treatment approaches, and physical therapy, as the name suggests, stays within the boundaries of physical and pain related concerns, joints, muscles, and all of that.
Thank you so much.
Also, to answer one more question, how a physiotherapist can help. So if I am seeing a child who has low tone and has postural control issues, I will also refer the child to a physiotherapist to go and do core strengthening exercises, do a lot of balance and gross motor skill training to improve in that area of skills, so that it will translate into other areas. Like when the child is writing, their posture should be upright. Only then the writing will be better.
Thank you so much. And perhaps as a follow-up to this question, in more of a general way, we've discussed so many professions today, so many types of interventions for a parent who has now got a diagnosis of autism. How can they navigate those different professions? What is really the process of directing families through these different services?
Let me take that question. So a good start is always a comprehensive assessment. A comprehensive diagnostic assessment will provide parents with sort of a good understanding of where their child is, and the child's strengths and the areas that are concerning and need intervention. Depending on the child's profile, you might then, because of course there are different types of therapies, and it's definitely not a one-size-fits-all approach. Therefore, upon a comprehensive assessment that must be done by professionals who are trained to do such assessments, then that can serve as a guide with respect to what does this child need right now, and also what needs to be prioritized, because unfortunately many families may not be able to access all services that might be required, and this could be for different reasons, financial, access, availability, timing, and many others. Therefore, that first initial assessment is critical. Then, depending on the child's presentation and depending on the child's individual needs, this is how you would, as a team, essentially, and this is where you want your multidisciplinary team. And CIDRA, for example, offers multidisciplinary assessments whereby not only you have a physician, but you also have an occupational therapist, a psychologist, a speech therapist taking part in the assessment. So that way, not only you get a very comprehensive report, but you also have access to those professionals. And then depending on the child's needs, you might prioritize certain therapies. A child might need a lot more occupational therapy intervention, for example, to start with, if there are concerns relating to sensory processing or regulation, and you might prioritize that more so than, for example, music therapy, which is another approach. Or you might, it's the same with respect to applied behavior analysis therapy and speech therapy. There might be some components, like for example, if a child is not speaking and the vocal imitation, so echoic, repeating, is not emerging, we might spend a lot of time in using ABA strategies, which are based on imitation. But if the child has a co-occurring apraxia of speech, you know, an intervention from a speech therapist who is prompt trained, and prompt, PROMPT, all capital, that Anila was talking about, you know, this would be essential for a child who presents with childhood apraxia of speech, for example. So it's really important to get that multidisciplinary, holistic evaluation right from the start, because this will help guide parents and provide them with that roadmap, essentially. And then along the way, depending on the child's progress and depending on you know, goals, and depending on the obstacles, I guess, that you do come across along the way, then you always, as a team, and this includes parents, clinicians, often teachers, nursery teachers, you would amend the intervention as required based on the child's individual needs.
Thank you so much, Ms. Camila. I really liked what you said about how therapy here is no size fits all. It really depends on each and every individual child coming to seek therapy. Perhaps we can move on to a really important question that we kept getting a lot. What do you think the impact is for early intervention? Or perhaps even on the other way around, what could be the impact of delayed intervention?
Right, so let me put it this way. Research shows clearly, and this is years and years of research, shows that early intervention results in better prognosis. Now, this is not to say that, you know, if a child receives intervention later on, for whatever reason, that there will not be improvements. However, as per the current research, and also anecdotally, this is what we see in clinical settings. If you start intervention early, the prognosis is better. You can start intervention very early. I mean, we've had children as young as 10, 12 months. Now, these would not be children who would necessarily have a diagnosis of autism, even though, you know, parents might have noticed or might have had some concerns, and these children may not go on to have a diagnosis of autism. However, some children who present with speech delays or any sort of global developmental delays would still benefit from intervention. Essentially, the answer is the earlier, the better. However, this is not to say that if for whatever reason the intervention is delayed, you know, the child cannot make progress. Again, rate of progress is a very, like, you cannot really put a timeline on it. You cannot, it's very difficult to predict. Unless you start therapy and then monitor data. Rate of skill acquisition is a good indicator. This is one of the indicators that tells us really how quickly we are meeting certain goals. So this is an important indicator with respect to the effectiveness of therapy, so to say. But I would say definitely early intervention. And what I see often is that, you know, you can have a child come to your consultation who is aged 2, and then you can have another child who come and is 4 or 5, and both children might present with the exact same skill set. Now, from a clinical perspective, if I see a child at the age of 2, of course, we're talking, you know, 2 years essentially of potential intervention. If that child comes at 4, we've sort of, you know, we have a delay of 2 years here, and you might see the exact skill set. So for sure, the earlier the better. This would be my recommendation.
Thank you. And I'd like to follow up with a question that we also got many times. Can starting intervention be ever too late, quote unquote?
Could you repeat the last part?
Can starting intervention ever be, quote unquote, too late?
Great. I'll let Anila handle that.
Yes, I do love this question. No, the short answer is no. Intervention can never be too late. When looking at a child who has a diagnosis of autism, or a child who's coming because of a language delay or a phonological processing delay, what we typically look at when developing a plan is developmental norms. What is the standard child developmental norm? So there's no such thing as too late to play catch up and to work on what are the skill sets that these children are lacking, or what are the skills that maybe, they need a little boost in order to get them to, have language skills that are closer to their actual age.
Just a follow-up to that question. So we've discussed the importance of early diagnosis and the importance of this comprehensive assessment as early on as possible. Could you maybe comment on the establishment of appropriate referral pathways here within Qatar, and also, maybe efforts that have been made at a national level to try to sort of raise awareness, especially within like school settings and other governmental institutions, to recognize early symptoms and to raise awareness about maybe possible pathways that exist?
Well, so I can start a little bit. I've been in Qatar since, yes, please.
Okay, Alex could actually give us some insight on that. Thank you.
So in terms of raising awareness, I think it was in 2018, but I might be mistaken. Qatar introduced the National Autism Strategy that basically covered a lot of not only awareness, but also the pathways for referrals, and sort of like organized what care is available in Qatar and who provides what. In terms of referrals, I think that the diagnosis can be made only at Sidra and Hamad. And in Hamad, there is a child development center which is just focusing on autism. I think they just moved to Wakra last year, Wakra Hospital. So they have psychiatrists, psychologists, developmental pediatricians, and also fellows and occupational therapists and speech therapists. And this is one pathway. And I believe you need a referral from PHCC to from like a general practitioner to be seen then at Wakra in this specialized clinic. And you can also be seen at Sidra, but then that you need insurance for it, and then I believe a referral can be made through a private provider, and then at Sidra you will have a multidisciplinary assessment with a developmental pediatrician, a psychologist, a speech therapist, and occupational therapist. And I know that Sidra doesn't provide follow-up sessions, so they provide education to parents and the assessment. However, they don't provide any therapy sessions. I know those can be found in Hamad and also in private sector. So that would be, in short, how you can navigate the referral process. And in terms of raising awareness, I would recommend to look into the National Autism Strategy, because that very clearly indicates how many areas were addressed and improved. And this work was done by almost all of the providers back in 2018, who sat together and developed the strategy and worked towards more inclusion of individuals with autism in Qatar. Thank you.
Thank you.
Thank you so much. I think it's really important that you mentioned Qatar's national strategy, and maybe can any of you elaborate on, or let's say recommend any training resources, any courses or online resources that healthcare providers can turn to if they'd like to find information about evidence-based management of ASD.
So there are many different providers that you can find online, especially when it comes to applied behavior analysis. As you know, we as board certified analysts, we need to keep updated and we need to constantly, we need to do our courses. So, I mean, a general source of information for not just professionals, but also for families would be Autism Speaks, right? It's an American organization, but in this website you can find a lot of different manuals. They are very detailed, and you know they give you guidelines as to how you can manage your child within the community or even at home, which many families struggle with. So I think this is a very good resource for non-professionals, but it's a very good one because this is based on applied behavior analysis professionals working on these recommendations.
I think if I can just add, I think it depends what are you looking for. If you're looking for strategies within applied behavior analysis, as Antonio mentioned, those would be the ones. But if you're looking into some other strategies, then you may look into, occupational therapy or speech therapy, or if it's something that a psychologist or psychiatrist or developmental pediatrician can help, then those would be the pathways. Like it really depends also on what are you looking for. And even if it's not Qatar based, there's plenty online resources that can be accessed, nowadays through online platforms.
Thank you so much.
With respect to occupational therapy, there is this very informative Instagram account. She is an occupational therapist herself. The account handle is OT Butterfly. She gives courses for parents and professionals like teachers. She is a mom of an autistic kid herself, and she's an occupational therapist also. So she also has a lot of informative, like 2-minute read articles on her website and her Instagram page, which is about small bits and parts about sensory integration, sensory processing. And she also has like 2-day courses, 4-day courses for parents and teacher training programs.
There seems to be some questions from specific healthcare professionals within the audience. And so we have a dentist, we have phlebotomist, and we have other healthcare professionals. And they're looking for your insights on how they can approach persons with patients that they see with autism. How can they deliver, person-centered care when they have persons with autism seeking their services? Is there any special things that they need to consider to make their appointments go more smoothly and so that they can deliver more person-centered care?
Most individuals with autism have sensory concerns. The recent research shows that, autism is closely linked to sensory issues and sensory processing issues. So a small screening will be a better option to start off with. So for example, when an appointment is made, there can be a small questionnaire that asks if there is any sensory processing disorder, or if the individual has any autistic traits or any sensory processing concerns. If so, the receptionist or the personal assistant can go on and ask a few questions related to what concerns, like, is it visual overload, is it sensory, like auditory overload, is it touch? So the concerning clinician is aware about what areas the problem lies in, especially if the parent can come along for the appointment. It is always better instead of the caregiver, because parent is closely associated to the child, and the parent has a better information about what the child is going to go through. The parents can be handed out a questionnaire before the appointment, and then if the certain criteria are ticked, like tactile, auditory processing, visual processing, maybe if possible the clinical setup can be modified, like dim the lights, like keep the sound low. I know with dentists it's a big challenge, like the drilling sound, the like when the instrument goes into the mouth, the child is really distressed. There was a recent study done from the UST Chan in the US. They modified most dental clinics around them to, keep soothing environment. They put up dim lights, soothing music, heavy weighted blankets on the kids before they started treatment. It has shown results. It's a study that's still in process, and the last 2 months of study says that the dentists had a better experience when they set the setting up in a specific way as recommended by the occupational therapists.
Thank you so much.
Yeah, that's really helpful. Thank you so much. You've mentioned screening tools that could be implemented, and advising that the patient's carer or parent comes along with them. That's really helpful tips. Thank you so much.
And I just want to reiterate that perhaps we will have more of a chance, inshallah, to discuss strategies to enhance care provision to patients who come to your clinics or hospitals who have autism, inshallah, in session 5 on May 22nd, which will discuss these strategies within healthcare and the community in general. Today we have so many questions in regards to different interventions or therapies, asking whether they're beneficial or evidence-based. We have a question here about neurofeedback. What is your opinion on neurofeedback therapy? Do you think do you know that it's evidence-based or that it can be beneficial?
So when we talk about sensory integration, it is partly a feedback form of intervention. So when we say that the neurons are in the developing stage, and that is why early intervention helps so much. So for example, if I'm seeing a child who's 2-year-old versus a child who's 4-year-old, the neuroplasticity of a 4-year-old is a lot lesser than a neuroplasticity of a 2-year-old, because the neurons have adapted to a certain environment, and the skill set, the learned behaviors and the learned skills are of that age now, 4. But if I'm seeing a 2-year-old, the neuroplasticity is a lot more, and I can work with that to develop skills and retain those skills. And it's still an ongoing research about how neural feedback is concrete and evidence-based. But yes, sensory integration uses a part of neural feedback mechanism when we are treating a child with autism.
Well, for the participants, can you perhaps just briefly elaborate more on what neurofeedback therapy is?
So neural feedback therapy is, for example, I am asking a child to do a shape sorter. So if I'm giving a child a square and asking a child to put the square in the square slot, the child is looking at the square and dropping it in the square slot. It might take a few attempts for the child to do that, but once the child does it, The feedback mechanism is a loop. Now, with repetition, the loop gets stronger and stronger. So now the attempts are reduced, and the child will most likely directly go to the square and do it. That's why when I'm treating a child, or when we treat a child, we keep challenging the child with more complex things, because a loop is formed and the loop will redirect the child to do it correctly. So I'm going to generalize the activity in different settings and try if the child can do a big square or in the bigger slot, a small square in a smaller slot. So that's how neural feedback works.
Thank you so much. Just to inform everyone participating today, we have still about 5 minutes in the session, inshallah, but Dr. Zach has also posted on the screen the QR code for the post-activity evaluation. Please fill this evaluation to confirm that you attended the session and get your CPD points. And please make sure to use the same email address that you used to log into the webinar. Our next question is very interesting. What are your thoughts on social skills training courses? So these courses provided by like development centers or like centers around Qatar in relation to soft skills, communication, public speaking, social interaction. What are your thoughts on these in terms of reducing symptoms of in individuals with autism?
So, social skills training for allied health professionals, teachers, parents, anyone who is working with a child on the autism spectrum is absolutely beneficial. And I think my thoughts are that that is amazing. That's great. And I think most people who work with children who are on the spectrum would benefit from that because, you know, communicate a large aspect of autism is difficulty with managing their environment, their social skills. So absolutely, these courses typically what they do is they break down a social skill. So waiting in line at the playground when you want to go on a slide, or greeting people in your day-to-day life. So they will break that down into very smaller parts, smaller bits, and teach people a variety of ways to show children how to manage those situations.
Thank you so much. So just to reiterate, you're recommending those courses for both healthcare providers and individuals with autism?
Well, so for individuals with autism, I would recommend, via a professional. So via your speech therapist or your ABA therapist or your special needs teacher. So via not to just willy-nilly take a course and assume that that will help, because, professionals are trained to know exactly what are the skills that, we should jump ahead. So I would definitely go via the professional route. And if you are a nursery school teacher, or if you are a teacher in elementary school, and there are certain skills that children generally have difficulty with, and you have a child who is on the spectrum in your class, then taking appropriate skills and finding out which visual stories, which narratives are going to help your students would definitely be beneficial.
Thank you so much. One thing that we didn't mention a lot today is pharmacotherapy and medications. What can you say about the use of medications and individuals with autism? Do they have a role? Can they help?
Could you please repeat, because I didn't hear the question properly?
Certainly. The question is about the role of pharmacotherapy and medications in providing care for individuals with autism?
So research shows that that can be combined with behavioral therapy such as ABA and can give excellent results in some children. However, you should consult this always with either developmental pediatrician or a psychiatrist, and only then implement it, and they'll be the most qualified to decide whether a child will benefit from it or not, and they will be able to monitor them throughout this treatment.
Thank you so much. Dr. Zakaria, do we have time for more questions?
I think we've got maybe one more question. We've got time for one more question before we wrap up.
Okay. Of course, we have a lot of questions, but don't worry, even if we don't have time to answer them today, we will keep note of them and inshallah answer them throughout the next two sessions that we have left, inshallah. So perhaps because today we talked a lot about therapy in relation to children with autism, and of course, because this is your specialty here in CDC, but can you speak a bit about therapy approaches for older children or even adults?
So while we have focused on children with autism here, many of these therapies are actually all of these therapies, in fact, would also be equally beneficial to children who may not present with autism. For example, some children who we see present with speech and language disorders, for example. Now, a child who only presents with a speech and language disorder may not need occupational therapy. However, speech would be very important. Now, if that child presents with some behavioral difficulties as well, then applied behavior analysis therapy would work really nicely along with speech therapy. What we also do sometimes here is we do multidisciplinary sessions whereby you have two professionals, like a speech therapist and an ABA therapist, working together with a child. Now, children who present with global developmental delay, which is a diagnosis that is given to children under the age of 5, where there are delays across different areas of development. Again, with respect to global developmental delay, this would require multidisciplinary intervention and occupational therapy, oftentimes physiotherapy, ABA therapy, speech therapy, oral placement therapy as well, oftentimes if there's difficulties with respect to the oral motor skills, all equally important. And to kind of tap into this question, oftentimes I have parents who come for consultations, or maybe clinicians are contacting us as the Child Development Center and saying, okay, my child does not have a diagnosis of autism, and you know, they come for a consultation. Now, while you might see some symptoms of autism or may not, now oftentimes parents would say, like, what if it's, you know, they might be waiting for an assessment or whatever, and they say, okay, so why would I be starting with, let's say, speech therapy or ABA or occupational therapy? Like, what if in 6 months time it turns out that it is or it is not autism? You know, would these recommendations remain the same? And the answer is, in most cases, yes, because recommendations are made based on the clinical presentation of the child. Of course, the diagnosis is similar, but is important, but there are many overlaps with respect to characteristics of certain diagnosis. So that's one. And two, a child who, so for example, if a child is non-speaking and aged, let's say 3 years of age, you know, whether or not it is autism, you must start speech therapy ASAP. you might like ABA therapy would also be very, very beneficial. So, you know, even if that parent returns with an assessment report saying, yes, it is autism, or no, it is not autism, it is, for example, a social communication disorder. So if you look at the diagnostic criteria of autism and social communication disorder in the DSM-5, which is the manual that you use, that psychiatrists use for diagnosing, you know, the difference really is in the sensory part, and there are many overlaps with respect to that. So so yes, these are applicable to many, yes, and also not just children, but also adults, including ABA, you know, so yes.
Thank you so much for this comprehensive answer, and we're really grateful for all of you to give us your insights and your expertise today. It was such an interesting discussion, such a dynamic discussion as well. Personally, I learned a lot, and we're looking forward to collaborating with you in future sessions and future programs, inshallah. Thank you, Ms. Camila Janik, Mrs. Alexandra Wood, Mr. Antonio Rena Hidalgo, Ms. Anila Mittal, and Ms. Sumaya Ravindrana.
Thank you, Dr. Shat and Dr. Zakaria. Really appreciate it. Thank you, and we'll see you in the next session.
So thank you very much, and thank you to our participants for joining today. We look forward to welcoming you to next week's session, next Wednesday at 12 o'clock, and the focus will be on creating a multidisciplinary system of care. Thank you once again to the Child Development Centre for your collaboration, and we look forward to future sessions with you. Thank you very much.